Borderline personality disorder, the most common symptom, the most important symptom, and the most dangerous symptom. What's up, everybody? Dr. Michael Barnett, board certified psychiatrist. Now, before we get into that, let's be clear here. Borderline personality, I call these folks survivors. These are people that have dealt with usually some kind of trauma or some kind of hit to their ego or something else and have to cope with the world in probably not the best way. Some people turn to substances, some people turn to violence and other things. These are folks that at times can sort of implode. So I always like to throw that out there whenever I talk about borderline personality disorder. Now, the most common symptom is actually affective instability or mood swings. That's why these folks are often misdiagnosed with bipolar disorder when really there's no history of mania, but rather there's just mood swings. Number two, the most important symptom actually is a fear of abandonment. And you probably have to expand on your definition of abandonment. Oftentimes these folks can fear a certain rejection or cannot react well when things are opposed to their viewpoints, for example, and often do have a history of some pretty severe abandonment. So they will engage very often in ways that are maybe not as genuine to their true selves, or they'll act in a way that they normally won't because they fear the rejection or fear the abandonment, which obviously can be very problematic. Now, the most dangerous symptom of borderline personality disorder is actually impulsivity. This is the reason that they often can harm themselves, sometimes can even unalive themselves. And when the dangerous behaviors happen, when you review them and kind of do an analysis of it, often they are impulsive in nature. Reminder, very effective and strong treatment is DBT, dialectical behavioral therapy. Would love everybody's opinion. Hit me